Family-directed aggression is a label that we use to describe aggressive behavior that's directed towards a member of the household. This could include behaviors like growling, barking, snarling, snapping, lunging, or biting. Family-directed aggression is probably one of the most emotionally taxing behavior concerns, up there with intra-household aggression, which refers to aggression between pets in the household, and separation anxiety. And what those three behavior concerns have in common is that there's not much of a break from them. There is always a layer of concern. The problem is happening inside of the house. You sort of always have to have an eye towards those types of concerns. In both family-directed aggression and intra-household aggression, you often have family members who do not feel safe in the home, and that's hard. Usually the dog in question does not feel safe in the home because that's why dogs display aggressive behaviors. And then the target of the aggression does not feel safe in the home, whether that's the other pet in intra-household cases or in the case of family-directed aggression, the human. And this can be really hard. It can be difficult not to take it personally. So if family-directed aggression is taking place, what should you do? The very first step is, of course, management. We need to prevent the unwanted behavior from being rehearsed, and we need to prevent negative associations from strengthening while keeping everyone safe. It's important to note that management doesn't just speak to preventing the behavior from being practiced, but also the negative associations from strengthening. So for example, if I have my dog behind a baby gate or on a leash, and that physically prevents them from biting the person in the household, but they are still behind the gate, hard staring, or growling, or barking, or otherwise showing signs of stress, even lower on the stress scale, if they are having to actively practice avoidance and try to calm themselves down, those negative associations are still strengthening even though everyone is physically safe. And so that's going to continue to make the problem worse. So our management really needs to look, of course, at the physical safety, but also at the emotional safety. We also need a vet check. Up to 80% of cases involving aggressive behavior also have a pain component, either directly or indirectly impacting that behavior. In the video that this comment was left on that tagged me, the dog is also new to the house. And we do often see behavior change over the first days, weeks, and months that the dog is in the home. So much so that there's even a rule of 3 we reference: 3 days, 3 weeks, and 3 months. And as the dog gets used to who lives here, who doesn't, routine, structure, predictability, for better or worse, we may see their stress response shift. That doesn't necessarily mean that they felt comfortable before. It may just mean that they are more comfortable showing their discomfort now. I did catch in the comments that the original poster of that video says that the target of the aggression is not often home. So certainly things like that can play a role as the dog is adapting and trying to figure out who belongs where. So once we have our management in place, and we're taking care of things like looking for any underlying physical components that might impact the behavioral response, we need to figure out the function of the behavior. Family-directed aggression can appear for a myriad of reasons. At the end of the day, aggression is a request for more space, so that part is clear. But why do we need more space? It could be that the dog is afraid of the person in question. It could be that they're conflicted about the person as well, so maybe they are they like the person, but they don't like how the person touches them, or when they get loud, or things like that. There may be specific behaviors that leave the dog feeling conflicted and unsure. We could see conflict aggression, which is when there is some perceived conflict, whether that's a shared conflict or the dog is perceiving conflict, that maybe the human is not trying to be in conflict with the dog at all, and the dog responds aggressively there. So the person is telling the dog to get off of the couch, or trying to take something away from the dog, or trying to get the dog to go somewhere they don't want to go, and the dog uses aggression to say, I want more space for my body, I don't like what you're doing. Resource guarding can also be a common form of family-directed aggression. I know in this video, the original poster says they're worried that the dog is resource guarding them. I will say that in my work with dogs with dysregulated nervous systems, when we do see resource guarding of a person, it still is usually linked into that feeling of security. So they say, this person makes me feel safe. Other beings interacting with this person threaten my feeling of safety. There's also social facilitation. So sometimes we see, and this is, I think, more common than resource guarding, sometimes we see that our dogs are more likely to display an aggressive response, that fight response, over a flight or a freeze or a fidget or a fawn response. The underlying emotion might be the same, but they're more likely to display that fight response around their safe person because of social facilitation. You're here, you're my safe person, you make me feel like maybe this fight response is a better response, because I have someone else who has my back. For someone whose dog is displaying family-directed aggression, it's important to connect with evidence-based professionals who have a strong history in working with aggressive behavior and family-directed aggression. Certainly any methods that work to suppress the behavior. So any methods where the goal is to make the behavior less likely without identifying the function of the behavior is dangerous. For example, if I'm using a stern no, or an e-collar, or a water bottle, or a penny can, or any sort of methodology like that, where I'm just trying to shut down the aggressive behavior itself, I would be punishing my warning signs, not changing emotion. So the dog is still going to need space for their body, but they're running out of ways to say it. And so we don't want to engage in any behaviors like that. They are shown to make aggressive behavior worse, to increase anxiety, but you may lose your warning signs, and that's when bites happen out of nowhere. It's also really important to be working with a behavior professional who works with behavior concerns, because I certainly see a lot of the times folks will take their behavior concern and end up linked up with a professional who is more of a trainer than a behavior consultant. And so they try to address aggressive behavior, anxiety, hyperarousal with manners. A dog who feels unsafe in their body and is displaying aggressive behavior does not need a sit stay. They don't need to learn to go to a place. They need to learn to feel safe in their body. And so addressing aggressive behavior with manners is going to be frustrating for everyone, even if it's positive reinforcement. It can also be helpful to look at these things holistically. And so when I have a client who's displaying family directed aggression, I want a bigger picture. Am I dealing with a dog who has an anxiety disorder, and this is one piece of that? Or am I dealing with a dog who generally feels fine and safe and comfortable in the world, but they seem to have this one issue? And as pet parents, a lot of times we only identify the stressors that are most salient to us. So I can't tell you how often I might get a form back, a new client questionnaire, where I'm asking, say, like, how does your dog do at the vet? And one of the things that they say is they'll say, oh yeah, my dog is fine at the vet, very compliant, a little nervous, shaking and hiding under the chair, but he lets us do what we need to do. That dog is not fine at the vet. I think the dog would tell a very different story. But because they're not biting anyone, because we're able to do what we need to do, we discount that level of stress, even though it's vitally important to the bigger picture. And so we want to take a really holistic look anytime we're dealing with aggression or other behavior concerns, because it all matters, it's all connected. And then the actual work, so that's going to involve behavior modification once we have our management and our enrichment. Enrichment is, includes looking at things like, satiating needs, physical, emotional, social, etc., but also looking at like pain and sleep hygiene and nutrition and those sorts of things. Once we've handled that, the actual behavior therapy involves things like changing emotion, building social skills, teaching flight. It really kind of depends on what the underlying function of the behavior is, but we are changing emotion, giving the dog skills to handle stressors, increasing their resilience, and helping better equip them to handle those situations. Or sometimes, especially when we're dealing with really emotionally taxing behavior concerns, sometimes we're saying, is this sustainable? Is the risk acceptable? And if not, we may be looking at other options besides management and behavior therapy. Thank you for tagging me in this video. The original poster is certainly welcome to reach out if they'd like more resources, and I wish them the best of luck.